welcome to Olsem Wanem. In commemoration of the World TB Day on the 24th of March, Petramin has pushed for an awareness on TB. Tuberculosis or TB remains one of the most deadly infectious diseases despite being 100% curable. We look at the hotspot areas in the country and the importance of diagnosis and treatment.
Being clear warning sick me bin gat. That's a lot of time all doctor all talking me some you at TV. I'm not me clear some more TV that one sick too. Past time and plan can check all been to doctors all TV me not been experiencing. Alright, me time mixing la sick me say was some more sick playing TV and this like kind.
Like many people in Papua New Guinea, this father and grandfather was surprised to learn that he had TB. Back then, little did he know about the infection. Tuberculosis or TB has been and still remains one of the most deadly infectious diseases not only in PNG but globally as well. Shalala Hamadova, World Health Organization Officer for TB and leprosy here in PNG, gives us an insight into TB hotspot areas in the country.
Papua New Guinea is a high TB burden country in the Western Pacific region. And among of all these provinces, National Capital District is the hotspot for the TB. As you know, National Capital District is the home of only 5% of the Papua New Guinea population. But 25% of the TB cases are reported from the National Capital District. And besides National Capital District, high TB burden is observed in Western Province, Gulf, Oro, West New Britain and Morobe provinces also. Mainly TB is observed in the southern region. And TB is also in Papua New Guinea is among a young economically productive age group population. It means between 15 and 35 years old. And then also around 26% of the TB cases are also children, which also shows that there is a high transmission of TB infection in community and also in their households.
According to TB surveillance data, almost 75% of TB cases are reported in the urban areas. Country Program Director for World Vision, Dr. Kurt von Boguslawski, tells us that TB thrives where social indicators are low.
Have some hotspots, and as you know, TB is a disease which thrives under conditions where social indicators are very low. So if you have crowded housing, low levels of hygiene, other infectious diseases thriving as well, TB is an additional one. So it is not, it's not prevalent in areas where you have only villages. It wouldn't be a problem for PNG other than in the urban centers where actually in settlements people are living in crowded circumstances where poverty levels are high. That's where you get TB.
The National Capital District, for one, has around 25% of the reported TB cases. 25% of the reported TB cases are from children. TB also affects the most productive age between 15 to 35 years old. The question now is, how is TB transmitted? Dr. Randy Moke, a specialist medical officer in TB at the Port Moresby Hospital, tells us more.
Tuberculosis is an infectious disease. It is contagious and it's mainly contracted by hair or transmitted by hair, air droplets, and it's caused by a germ called Mycobacterium tuberculosis, and it's mainly transmitted through air. So you do not get TB if you share food or by any means of contact. It's mainly through coughing, sneezing, talking, singing, laughing. So it's mainly transmitted through that by someone who has infectious TB. So mainly TB of the lungs, and mainly those people who are coughing have a potential of spreading TB to anyone.
Welcome back. We now look at the risk of tuberculosis transmission and its signs and symptoms. It is said that the risk of TB transmissions has increased in overcrowded and poor living related environments.
It depends. The TB can survive in an environment that is enclosed and it can remain there for a longer period of time. Now, if somebody is coughing outside, where it is good airflow, where there is exposure to sunlight, TB dies at least within 5 minutes or so. TB can die, and once exposed to sunlight, which is UV light, can actually kill off the TB germ. So TB is like in an enclosed space where the area is not ventilated well, where there is no exposure to light, particularly the sunlight or UV light. TB can actually, if there is no exposure to such, then it can survive in an enclosed area for a long period of time.
TB germs can also float in the air for several hours, so it is possible to inhale them even when the sick person is not in the same room as you are. Therefore, proper ventilation is very, very important.
Infection, the risk of TB transmission is increased in overcrowded and poorly ventilated environments. And as we know that in rural areas, and I have seen myself also, there's houses which are called kunai, and these houses usually have no windows. And it means that if someone in that house get infected with TB, get disease with TB, then this person can easily transmit his or her disease to the other people, because there is no windows, no ventilation. And in the cities, and as we know that the people live in, some of the people live in informal settlements, and the informal settlements are also overcrowded.
3 weeks, but anyone who is coughing even less than 2 weeks, we must suspect that person of having TB. And sometimes this a person who has TB can have hemoptysis, meaning coughing up blood. So sometimes, because TB mainly affects the lungs, it damages the lungs, and this person can cough up blood as well. Now, that is the main symptom. So somebody who is coughing, we must suspect having TB. Now, other symptoms may be associated with TB as well, but quite non-specific, like weight loss, sweat in the night, poor appetite, or shortness of breath.
Me been one TB patient, yes. Le sick me no been save tasol. Me been kisim fever, me kisim skin weight loss, or like an sign symptom been come up on me. Na me no sa kege good. Me say sleep tasol. Cold night, me say feeling cold, not like an you can come up on me. Okay, go now family only get up now, only kissing me along our sick. I go along our sick now, only find out of some make it like an sick.
Did you know that not everyone infected with TB bacteria becomes sick? For some people, the bacteria can remain dormant or asleep for years and without any TB disease. This is called latent TB. People with latent TB have no symptoms and cannot spread the bacteria to other people. However, they must still be tested and treated, as they can develop symptoms and become contagious at any time.
So we must know that being infected is different from having the disease. Somebody can be infected, but later on in life may develop the disease, TB itself. So if you're infected today, you may for the next year or two, or maybe in your lifetime, may develop TB, depending on the risk factors you may have. For instance, if you are exposed to TB germ, or more often, frequently, the chances are that you may develop TB. Or if you have lower immunity for various reasons, for instance, somebody has HIV, or somebody who has low immunity through malnutrition, or somebody, particularly children, who have lower immunity, are more at risk of developing TB. So there's a difference between being infected with the TB germ itself and somebody who develops TB some years or down the line.
People who are most at risk for developing TB diseases are the elderly, small children, smokers, people who already have an immune system problem such as HIV, people who do not regularly see a doctor, and people who live in crowded conditions. Western Province, Gulf Province, and the National Capital District are three main TB hotspot areas in the country. Despite being 100% curable, TB can become a very serious and fatal disease if left untreated. Like many other doctors, Dr. Randy Moke, a TB medical officer at the Port Moresby General Hospital, is on the front line in the fight against TB. He gives us an insight on the number of TB cases that are reported at the Port Moresby General Hospital.
And most of these TB cases that come in are retreatment cases, means that they have been started on treatment but are not coming back. Now they have either defaulted, meaning that they've started on treatment and now they've missed their treatment and are coming back. And for various reasons, they've gone without treatment. Now there is also a concern. So what is happening with those patients that we are diagnosing and are sent back to their respective health facilities and which they are expected to continue their treatment? What is happening? You know, that is a concern that we need to address at those levels. We have to make sure that these patients continue their treatment. Now, when these patients, most of these cases, as I've said, 384 that has been admitted in 2014, most of these cases has been a retreatment case, means that they have defaulted and are coming back. Now, these patients, they are too sick, they're coming back, and they have a higher chance of developing drug-resistant TB as well.
The diagnosis of TB follows several laboratory tests of the blood and sputum. A chest X-ray is also done to visualize the tuberculous in the lungs.
To make sure. So when patients come, we give them at least 2 sputum cups. We give one at least for on-the-spot sputum collection and one in the morning. The morning one gives a higher yield or higher chances of picking up the TB germ itself.
In 2006, Mr. Savos found out that he had TB. Unlike many people, he was happy to know what his infection was and immediately got on treatment.
I've been talking about me got TB. Me not been feeling on blasani. Ta me ham maso se mal funny mouth this like I'm sick, long body will me. So I'll talk to me also. You must drink marasin blue, number you come up or I can. So maybe harim talk lol. Me not miss him one pla marasin, table marasin. Me complete him all the days. He go up long month only make him 6 months long. Me complete him.
Taking medication accordingly is very important. If medications are not taken as prescribed, or the longer one goes without treatment, the more difficult it is to treat and the more deadly it becomes.
Many people along the line, they default, meaning that they are not faithful with their treatment. They take the medicine, they feel better after 2 months, 3 months, and they stop medicines at their own accord. Now these people, when they come back very, very sick because they have a severe form of TB. Now in most cases, these people, they tend to develop drug-resistant TB as well. Now therefore it is very, very important that once we start someone on treatment, we must make sure that this patient complete their treatment. If it means 6 months, they must complete that 6 months treatment. If it means 9 months, they must complete the 9-month treatment.
Since 2006, the number of drug-resistant TB cases has increased.
If I am not mistaken, Papua New Guinea has started to report the MDR TB cases since 2006. And initially, Papua New Guinea did not have enough capacity to detect the drug-resistant TB cases. But later, National Department of Health, they purchased around 20 gene expert machines, and these machines are very good for detecting of the drug-resistant TB. With the help of this machine, drug resistance can be detected in less than 2 hours.
What we have seen is that Western Province need a bit of help, so that is why the department have decided to call for emergency response. So we have currently submitted a submission to NEC for accelerated response to TB in Western Province, particularly in the South Fly. The reason why that was launched is because the other provinces have taken steps to address, the TB issues, taken steps to improve the TB program. However, Western Province has not made any progress at all. Their administration needs to improve and take ownership and start doing some progress in TB. Their partners on the ground, Bennett Institute under HHISP, support, that is support from DFET. And then we also have World Vision also involved in the province. Their partners also working on the ground.
With the increasing tuberculosis cases as well as drug-resistant cases, Petramin has pushed for awareness in this episode. NGO groups such as World Vision, Medicine Sans Frontier, and the World Health Organization are working closely with provinces and the health department.
Primary organization is responsible for TB is the Department of Health. But as you said, that TB affects everyone in country, and recently we've been hearing more and more of this TB. Currently, the government works in partnership with other non-government organizations as well, and the provinces, because they are the custodians of the programs. So currently we have the provinces implementing TB activities, and we also have partners.
This year, 2015. So there's been a lot of progress in terms of the treatment coverage. We now have about well over 200, I think 269 or so basic management units throughout the country that's involved in providing the treatment. So in numbers that's increased, but in terms of the quality and the care providing, that's as a result of the strategies that we have, there's a lot of work that needs to be done.
Okay, so as you know, maybe there is 3 hotspots on TB in PNG, Western Province, Gulf Province, and NCD. They are considered as hotspots because of the number of cases, of course, and the number of new cases every year. There is also a problem of loss to follow-up of the patient. So MSF decided to intervene in Gulf Province, and we start our medical activity in July 2014. We provide support to Kerema Hospital, so we reinforce the lab capacity by providing a machine called GenExpert to test the patient, and we are proposing also support during the consultation. We are currently building a TB ward according to the international standard to be sure that we can deliver the quality care. Everything is done in close collaboration with the team of the hospital, of course, and with the province. Our objective is to be able to cover the province in 5 years and to create a model of care for TB, especially in the countryside, because it's a specific environment, and to be able to hand over this model of care to the health authorities of the country. So we are currently working in close collaboration. Our staff, the staff who is working on TB is also the staff of the NDOH and the province, but we are supporting them and we focus on capacity building basically.
Apart from Medicine Sans Frontier, World Vision is another NGO group that deals with TB.
Over the years, we've seen a steady increase of TB cases in PNG, and that is actually a sign that the national TB program is starting to work. Because if you don't detect the cases, you can actually not treat them. It is a difficult thing to understand for some, because every year we're increasing the detection of numbers of cases, and it looks as if there's more and more, but it needs to be like that. If you don't detect TB, you cannot treat it. So I would openly say it's actually a good sign that the TB cases are increasing because our detection is working. We still need to do a lot of work to detect every single TB case. So our awareness is geared towards people going actually with the symptoms to the health clinics, to the BMUs, and getting diagnosed.
And so we are fortunate to have the engagement of partners who've had experience in this, like Medicine Sans Frontier, but of course also the World Vision Partnership is important in helping us deal with funding and support in terms of many of the issues where we struggle with, and then of course DFED coming in. So partners are very special in helping us get through.
With that, there are also volunteers like Mr. Savos. Following his diagnosis and treatment and overcoming TB, Mr. Savos has become a TB volunteer in his 9-mile community in Port Moresby.
TB awareness in the community and only not clear good. That's all. More awareness me been working now. I'm somehow clear now.
Tackling TB is a task that involves the participation of everyone. This awareness was brought to you by Petramine.
Protect yourself against TB.
That's all for this episode. We would like to thank Petramine for sponsoring this episode. Many thanks as well to the Department of Health, Port Moresby General Hospital, World Vision, Medicine Sans Frontier, and everyone that has participated. If you have any questions or comments you would like to share, please send us an email through the address on your screen or visit us on our Facebook page. Until then, it's goodbye for now.